Hello and Happy New Year. Welcome to 2019. I'm Reverend Portia Cavett, a Together to End Stroke ambassador and producer of For the Love of You show. Thank you so much for joining us today. I pray that you are indeed moving more, sitting less, and being your best as we try to make sure that we take care of ourselves. Today's show will just be a conversation that I will have with you as we recognize and understand how important our overall health is, but especially as it relates to alcohol as well as cigarette smoking. So today, as we begin the conversation, there'll be times that I'll look directly at you, and other times I'll be looking at some notes of information that I got from the American Heart Association website as various things so that we can have a conversation. But I would always encourage you to contact your doctor and have in-depth conversation with your doctor or medical provider. And so the effects of smoking and drinking on the cardiovascular disease and the risk factors as it relates to heart disease is the narrowing of the arteries that supply blood and oxygen to the heart. Alcohol consumption of 3 or more drinks a day and cigarette smoking share similar and probably addictive effects on the form of cardiovascular disease. Remember that strokes is the 5th leading cause of death as well as disabilities. In the state of Nebraska, our average age of someone having a stroke is 42, and even before during the age of 46 to 50 or 65 has been seen at the Nebraska Medical Center. As we continue to look at the effects of alcohol and tobacco as it relates to cardiovascular disease, I am not a doctor, so I cannot truly do this subject justice, but I just want to have a conversation and to point out that when a person drinks, it can associate with a lowering part of a heart attack, but we want to make sure that we understand what cardiovascular disease is: a blockage in the arteries that supplies blood to the brain, resulting in deficiency in the blood flow and failure of the heart to pump blood sufficiently throughout the body causes congestive heart failure. And so if we're looking at some of the things that we take into consideration or that we do that affects our bodies, we have to begin to make some changes. In 2019, I'm sure that we all made some New Year's resolutions that we would take better care of ourselves, and so at this point want to make sure that we do just that. We recognize that stress may come upon us and different things that we go through, but stress also causes us to or affects our health each and every day. So if you choose to drink too much alcohol and smoke cigarettes to manage your chronic stress, then you will develop habits that will increase your blood pressure and could damage your artery wall. So I want to make sure that we look at it in all aspects of our lives, because stress can be a headache, it can be back strain or stomach pains. Stress can zap your energy, wreak havoc on your sleep, and make you feel cranky, forgetful, or out of control. And so when we recognize the stress that we have, sometimes we might want to pick up a drink, we might want to pick up a cigarette and smoke, but want to make sure that you understand the difference between stress and anxiety as well as to deal with that. Managing stress reduces or prevents heart disease. It's a good idea to know your overall health. First of the year or around your birthday, whenever your normal physical or annual checkup with your doctor is, that you want to go in and to have a conversation. There might be a question that's asked: how are you feeling? Do you feel overwhelmed? Are you not sleeping? And so you want to address that. But when we look at how stress affects heart disease and strokes, people who feel distressed or anxious or overwhelmed because of stress, you need to have a conversation with someone. Sometimes just talking, just sharing with someone else and allowing them to share with you can indeed help. You can exercise a little bit more, maintain a positive attitude, not smoking or drinking too much, cut down on the cups of coffee that you have during the day, enjoy a healthy diet, and maintain a healthy weight are all good ways to deal with stress. I know I need to get to the gym or I need to walk a little bit more, but the fact that I am working each and every day, I'm up and moving, that I like to think that I'm putting it together. It's not just 30 minutes in the gym, but all day long trying to make sure I move. Remember, we told you in the midst, if you're watching television, get up during the commercial, move around, even at work. Park a little bit further, walk. If you go to the store or the mall, park farther away so that you can walk. You need to do more physical activity to help you along the way. We're still in the winter months. It gets darker early during the day, as well as when many are going to work in the morning. It's still dark. Our bodies feel that if it's dark, then you ought to be sleeping, you ought to be resting. But we want to make sure that we do not allow stress to affect us during the winter months that we find ourselves in. Want to now talk about how alcohol or drinking affects your heart. That heavy drinking can cause serious heart problems such as liver disease, cancer, peptic ulcers, as well as other conditions. And so when we think about the regular or high alcohol use, it hurts your heart and leads to diseases of the heart muscle called cardiomyopathy. I might not get the words right, but you can also ask your healthcare provider. Drinking alcohol regularly can also raise your blood pressure. For some people that already have high blood pressure, you want to take that in consideration and cut down. We know that there should only be 1 drink a day for women and 2 drinks for men. That's the moderate drinking. What does that mean? That's a 12-ounce can of beer or a wine cooler, 5-ounce glass of wine, or 1.5 80% proof of alcohol. I had an opportunity earlier this month to go down to the Liquor Control Commission to testify against a liquor license, but want to make sure that people understand what is considered a drink, 1 drink or 2 drinks for men, and that's why I bring up the sizes so that we don't overdo it. We know that when we have too much to drink, that it affects us in our driving, it affects us in our thinking, it affects us in our activities. And so alcohol effect on the lungs causes breathing to stop. You can also have alcohol poisoning that might lead to death, because alcohol lowers the resistance to infection. And during this time of the pneumonia and flu season, we want to make sure that we are healthy and not have the aspiration of food or fluids in our lungs. Is alcohol good for the heart? Moderate alcohol can indeed increase your good cholesterol and reduce inflammation as well as blood clots, but want to make sure that we are all aware of the LDL, the bad cholesterol, that we are to keep that number below 70, And if you are already on cholesterol medication, you need to take your medication before going to bed, because the bad cholesterol fights against you when you are indeed sleeping. And so we want to take in consideration, I know that you've heard that red wine is good for you, but you have to do it in moderation. We have to learn how to cut back. Yes, alcohol is available for us. Some people use it or take a drink to calm them down, to relax, to unwind from a busy day. But I want to make sure that you know the effects that alcohol and tobacco use has on your body. You are the best caretaker of your body. And as you continue to love yourself, you have to make sure that you are in tune with your body and understand what your body, messages that your body might indeed be telling you. There is so much information that I can't comprehend it all in order to share, but want to make sure that we understand the effects of cardiovascular disease, such as a blockage in the artery that supplies blood to the brain, the deficiency in blood flow, I believe it's pronounced ischemic stroke, or the failure of the heart to pump blood sufficiently throughout the body is congestive heart failure. So make sure that we understand what is happening in our particular body. Smoking is clearly linked to a higher risk of nearly all forms of cardiovascular disease, including myocardial infarction, ischemic strokes, and bleeding of the brain, or having a hemorrhage stroke, as well as congestive heart failure or the narrowing of the arteries. There is so much. That's why your healthcare provider is there. You can get whatever information you need. Get to know your body. Allow your body to continue to speak to you. Listen, pay attention. Understand why you're feeling that way. Get plenty and proper rest so that you can be the best you in 2019. We look forward to continuing to bring you the segment For the Love of You. For God is indeed love, and we have to learn how to love ourselves. There will be a flyer that will come up after the end of this presentation, and would ask that if you have any questions about alcohol or want to talk about alcohol use or consumption, I'll be more than happy to talk with you or to direct you to the proper persons that can answer your questions. And then there will be the Pamper Day that the Together to End Stroke ambassadors will be having on Saturday, February the 9th at Clare Memorial United Methodist Church, 5544 Ames Avenue. We always have this event on the second Saturday in February, right before Valentine's Day, to help you to take care of yourself, to pamper yourself, to love on yourself. We look forward to having massage therapists, exercise gurus, skincare products, a cosmetologist to talk about eyebrows, someone to do nails, persons to that will have jewelry or candles that you can do aromatherapy. We want to make sure that we pamper you on that day. Some items are, or the activity is indeed free. There might be items for sale there that people will have tables that you can come and get some products or purchase some products. But we just invite you to come and share between 10 and 2 p.m. on Saturday, February the 9th at Clare Memorial United Methodist Church. And then there is another event that is happening at Girls Inc. I believe that event is from 12 to 3, and it is the National Black Awareness HIV and AIDS Day. And so as we look at the health of everyone around us, that we make sure that information is made available. I know that there is so much more that I could talk about as it relates to the side effects of smoking and drinking as it relates to cardiovascular disease, but I want to make sure that we take better care of ourselves. The increasing number of strokes that people are experiencing, we can indeed prevent strokes, but we have to be in tune with our bodies. So please do what you can. Take care of yourself. Get as much information as you can. As I was doing some research and looking, I made myself a note that there is also what is called wet brain, is a form of brain damage as a result of repeat and heavy exposure to alcohol. And I can't even pronounce what wet brain is, but the WET stands for, if I say it wrong, I apologize, Wernicke-Korsakoff syndrome, which is thiamine, vitamin B deficiency, and alcohol hinders the absorption of thiamine that is stored in the liver. And so as I was doing research, as I was looking, if I've said anything, please check it out. Please find out the information that is best for you, but also talk with your professional provider or healthcare provider so that you can get the answers that you need. We want to make sure that we understand what is happening to our bodies and try to prevent stroke and heart disease. How? Be healthy. Take care of yourself. Health is the best wealth that you have, and so we need to make sure that we are loving on ourselves each and every day. I love you, I care about you, and I want you to be the best that you can be in 2019. Until we meet again, thank you for tuning in for the love of you.